Tinubu has expanded primary healthcare center funding to 13,500 facilities across Nigeria. And this is one of the biggest moves we have seen in the health sector in recent years. This is not just talk. This is money already released and centers already receiving support. Viewers, as we go deep into this gist, please like this video and subscribe to this channel so you do not miss important updates like this. Your support helps us continue bringing you real-time news in simple and clear English. Now, let us understand what this really means. Primary healthcare centers, also known as PHCs, are the first hospitals most Nigerians visit. They are the small health centers in our communities. They handle pregnancy checkups, child delivery, immunization, malaria treatment, basic infections, blood pressure checks, and general health advice. For many families, this is the only hospital close to them. For many years, these centers had serious problems. Some had no light, some had no clean water, some had only one health worker, some did not have enough medicine. Many closed before evening because there was no funding to run them. So when we hear that funding has been expanded to 13,500 facilities, this is something that can affect millions of people. The government said over 98 billion naira has been disbursed in 2025 alone to strengthen primary healthcare delivery across the country. This money is coming through the Basic Healthcare Provision Fund. That fund was created to make sure grassroots healthcare gets direct support. It is meant to pay for operations, drugs, minor repairs, equipment, and support for health workers. Initially, and over 8,300 primary healthcare centers were supported. Now, the expansion adds more than 5,000 additional facilities. That is how the total reached 13,500 across Nigeria. That number covers almost every local government area. If properly managed, it means many communities that were neglected before can now receive attention. Please pause and like this video and subscribe. It helps this information reach more Nigerians who need to understand what is happening in the country. Now, what exactly has changed on ground? Reports show that thousands of PHCs have already been upgraded. Renovations have started in many states. Some centers now have better roofing, painted walls, hospital beds, delivery rooms, solar power systems, and water supply. In several places, they now operate 24 hours. So this is important because emergencies do not wait for morning. Another major part of this expansion is training health workers. Since 2023, tens of thousands of frontline healthcare workers have received additional training. These include nurses, midwives, community health extension workers, and support staff. Training improves service quality, it reduces mistakes, it increases patient confidence. When people trust their local health center, they go early for treatment instead of waiting until a sickness becomes serious. Let us talk about mothers and children. Nigeria has faced challenges with maternal and newborn health for many years. Many pregnant women in rural areas struggle to access safe delivery services. With this new funding, there is stronger focus on maternal care. Some centers are now better equipped for safe deliveries. Yet, there are efforts to track pregnant women and connect them to nearby facilities. Emergency maternal services are being supported in certain areas. This is a big deal. When a mother survives childbirth and a baby is born safely, that strengthens the whole family and the entire community. Another part of the story is health insurance expansion. Millions of vulnerable Nigerians have been enrolled into health insurance schemes. This means some people who could not afford hospital bills before now have financial support. When healthcare becomes more affordable, people seek treatment earlier. Early treatment saves lives and reduces long-term health complications. Let us also look at the economic side. A healthier population means a stronger workforce. Farmers can go to their farms. Traders can open their shops. Children can attend school. Healthcare is not just about hospitals, it is about national development. When basic healthcare is working, it reduces pressure on big teaching hospitals. It reduces overcrowding. It allows bigger hospitals to focus on serious cases. Please like this video and subscribe. Right now, we are breaking everything down in simple English so everyone can understand. Now, many Nigerians are asking an important question. Will this money truly reach all communities? Implementation is always the real test. Announcing funding is one thing. Making sure drugs are available, workers are present, and services are truly free or affordable is another thing. Some citizens say they are waiting to see physical evidence in their local centers. That is a fair concern. Monitoring and accountability will be key. Community members must also be involved. When funds are allocated to a local PHC, the community should see changes. They should see improvements. They should ask questions respectfully if nothing changes. Transparency builds trust. Another angle to this story is power supply. Many rural centers struggled because there was no stable electricity. Some upgrades now include solar systems. Solar power helps keep vaccines cold. It keeps lights on during delivery at night. It allows small equipment to function properly. These small improvements can make a big difference. Water supply is another major issue. Clean water is necessary for hygiene, childbirth, and infection control. Some centers have received boreholes or water systems. When hygiene improves, infection rates drop. We must also understand that healthcare is a shared responsibility between federal, state, and local governments. The federal government may release funds, but states and local authorities are involved in management. Cooperation across all levels is necessary for this expansion to succeed. In some communities, people are already reporting better services. In others, progress is still ongoing. Nigeria is a large country. Change does not happen at the same speed everywhere, but the scale of 13,500 facilities is significant. Let us talk about rural Nigeria. In remote villages, some people travel many kilometers before finding a clinic. Transport costs can be high. When a local PHC is functioning properly, it reduces travel stress, it reduces transportation costs, it reduces delay in receiving care. That alone can improve health outcomes. Children benefit greatly from strong primary health care. Immunization programs are usually handled at PHCs. When funding improves, vaccine availability improves. That protects children from preventable diseases. Healthy children grow better, learn better, and become productive adults. Now think about malaria, which remains common in many regions. Quick access to testing and treatment at a nearby PHC can prevent severe illness. Early diagnosis reduces complications. That is why strengthening primary care is strategic. Some analysts describe this move as focusing on prevention instead of only treatment. Primary healthcare is about preventing diseases before they become serious. It includes health education, hygiene awareness, nutrition guidance, and regular checkups. Prevention saves money in the long run. Please do not forget to like this video and subscribe. We are giving you professional, real-time news breakdown in a way everyone can understand. Let us also consider job creation. When facilities are upgraded and expanded, more health workers may be employed. More cleaners, record officers, and support staff may be needed. That creates economic opportunities at the community level. Another related development in Nigeria's health space is increased attention to local production of medical supplies. There have been conversations around strengthening domestic pharmaceutical manufacturing. If Nigeria produces more medicines locally, PHCs may have more stable supply chains. That reduces dependence on imports and improves availability. There is also ongoing conversation about digital health records. Some upgraded centers are beginning to improve record-keeping systems. Accurate records help track patient history. Lastly, they help monitor disease trends. They support planning and resource allocation. However, challenges remain. Nigeria's population is growing. Healthcare demand is increasing. Funding must be consistent. Maintenance must not be ignored. Renovating a center is good, but maintaining it yearly is equally important. Community engagement will determine long-term success. When citizens value their PHC, they protect it. They report vandalism. They support cleanliness. They encourage pregnant women to attend antenatal clinics. Social behavior plays a big role. The expansion to 13,500 facilities sends a message that primary healthcare is being taken seriously at national level. For years, many experts argued that Nigeria focused too much on big hospitals in cities while rural clinics were neglected. And this move appears to shift more attention to the grassroots. Healthcare experts often say strong countries build strong primary care systems first. Secondary and tertiary hospitals are important, but primary care is the foundation. Without a strong foundation, the system struggles. As citizens, it is good to stay informed. It is good to ask questions respectfully. It is good to share positive experiences and also highlight areas needing improvement. Please like this video and subscribe again. Your engagement helps spread awareness. Looking ahead, the real measure of success will be visible results. Are maternal deaths reducing? Are child immunization rates increasing? Are malaria cases treated earlier? Are rural families spending less on emergency travel? These are the indicators that matter. Yet Nigeria has faced economic pressures in recent years. Allocating billions of naira to healthcare shows prioritization. But economic realities also mean funds must be used wisely. Efficiency is critical. We will continue to monitor updates as more states complete renovations and as more centers become fully operational. Citizens should pay attention to announcements from their state health ministries regarding upgraded facilities near them. If your local PHC has been upgraded, share your experience in the comments. Tell us what has improved. Is there 24-hour service now? Are drugs available? Are nurses present? Your comments can help others understand what is happening across the country. And if you are new here, please like this video and subscribe. We bring clear, professional news updates in standard English that everyone can understand. And this story is still developing as implementation continues across states. Funding expansion is one step. Sustained performance is the next step. The coming months will show deeper impact. Healthcare is personal. Every family is affected by it. That is why this headline matters. Expanding funding to 13,500 primary healthcare centers is not just a government statistic. It represents potential change in villages, towns, and cities across Nigeria.